The last time we were all here together was May 1st of last year, where we had a rally at the Statehouse for healthcare as a human right. We did it on a Friday, and we wanted to do it when the legislature was in session, when the governor was here. We were told that it was crazy to try to do it on a weekday because not a lot of people would show up. In the end, we had 1,200 people participate, and we were told it was the largest weekday rally in the history of the state. This fall, we held people's forums on healthcare all over the state. Over 800 people participated, over 70 legislators. And what we heard loud and clear in communities across Vermont is that the time is now for change on healthcare. And today, we're here to deliver that message. I'm proud to introduce our first speaker, who's going to be speaking, representing nurses and health providers and Vermonters across the state. Jennifer Henry, the president of the Fletcher Island Nurses Union and the United Professions of Vermont, American Federations of Teachers. Thank you.
It's great to be here today. As James said, my name is Jennifer Henry. I live in Essex, Vermont. I am a wife and the mom of 4 beautiful children and a registered nurse at Fletcher Island in the recovery room. And I also have the privilege of being the president of the AFT unions in the state of Vermont. United Professions is our state federation, and the Vermont Federation of Nurses is the union that represents nurses and technical professionals at Fletcher Island. We're all here today because Vermonters want health care to be considered a human right. As a nurse and a community member, I know that the Vermonters I know are proud and strong. And when they're not well, and when they're feeling sick and they can't speak up for themselves, when they're at their most vulnerable, we, the rest of the folks who can be here today and who have signed postcards and who are being active to try to get change in Vermont, help to speak for them. In the hospital, as a nurse, and as nurses here, we've experienced folks who come in who are in pain, who are facing surgery, who are facing some of the scariest times of their lives. And what they talk to us about is about how they're going to pay for their health care. That's their biggest concern. And when they don't speak of it, sometimes their families take us aside and ask who they're supposed to speak to at the hospital, or they wring their hands and wonder what they're going to do, and just pray that they're going to make it through their immediate problems at the hospital, and then have lingering problems as they deal with the cost of having to pay for visiting the hospital or for getting health care. And those are the folks who have access to health care. We know that we can no longer tolerate excuses, that what's so exciting about this movement is that we're hearing everything change from why it can't happen to why it can happen. And it's so wonderful to have our leaders speaking about how Vermont can be the first state to make sure it happens for our citizens. That's the type of and we will measure the leaders here in the Statehouse and all across the state by their can-do attitude and their willing to keep going and keep fighting until change happens.
That's right. Because we believe that people with disabilities have the right to live with dignity and the right to appropriate support from our healthcare system. Our current system and the federal reform proposals do not guarantee dignified support and care for all. Concerns over money, administrative procedure, and other barriers often override people's dignity. The human right to health care requires that health services respect people's dignity. This means we must foster a culture of dignity in the healthcare system that helps prevent neglect and degrading treatment. We must have a healthcare system that is responsive to people's needs. For example, to respect dignity means that individuals should be able to receive care and support in their own homes so that they can live independently. At this time, all Vermonters are entitled to care in nursing homes, but not afforded the same entitlement to services for living where they choose, usually their own homes. Healthcare should not be sick care. It should enable all of us to be healthy as we can possibly be. That's not what the current system is set up to do. It mainly provides Band-Aids instead of protecting our health in a holistic and coordinated way. The healthcare system we need does not include pre-existing condition worries or partial coverage. In a human rights-based system, no one would have to worry about transportation to a doctor, or necessary equipment, or other services that support independent lives. Many people are surprised to find out when you acquire a disability, for example in a car accident, that someone doesn't show up at your doorstep with a wheelchair or other equipment or provide you a ramp to your home. These items are crucial for someone to regain their independence and remain in their own communities. A healthcare system that is responsive and sensitive to people's different needs must fully engage us in order to identify and meet our needs. Everyone should be able to participate. We should control and care what we get. We should also take part in the decisions about how healthcare is administered and delivered. The human right to healthcare requires that our resources are used equitably according to health needs, not any other factor. This means that those communities and individuals who need more care or different services should get those easily and without financial or administrative barriers. We can make the best use of our resources if we enhance primary care services and guarantee continuous, coordinated care and primary care practices for all, including individuals with chronic conditions. But we can achieve none of this if we don't meet the most basic rights and standards of non-discrimination. Despite the laws in place, discrimination continues to be a problem, even if it is not intentional. For example, the federal reform proposal allows insurers to discriminate against older people by charging them more. And they allow employers to link insurance premiums to the ability of employees to achieve certain health-related targets. This is unacceptable.
It is wonderful to see so many people here today. This is just great. The enthusiasm is awesome. I represent 11,500 educators in Vermont, and we are all very much interested in this issue. I've been a Vermont teacher for 30 years, and educators know the importance of access to high-quality health care for their students every bit as much as for themselves. That is why my organization has, for decades, stood up for health care as a human right. We support in our Vermont NEA resolutions the adoption of a universal health care plan for all residents of Vermont. This includes both adults and children, our students. We care deeply about the needs of our students, and when they are deprived of good health care, they can't be ready to learn. They can't do their best, and they can't achieve to the standards we set for them. When our adults are dependent upon employment in order to have access to good health care, our system just doesn't work well. It certainly doesn't work well at all for people who become unemployed and lose their insurance. When our system is full of cracks and healthcare potholes, we respond by attempting to fill them with such things as COBRA rights and mandated coverages and blocking pre-existing condition coverage denials. And we continue to spend and spend more and more of our private and public dollars as though the edifice is strong and the floor well paved. The current system is simply unsustainable. Vermont NEA's principles of healthcare policy reform maintain that access to healthcare should be established as a fundamental right of citizenship. Every educator and student and every citizen deserves a system for healthcare that does not place access in jeopardy when job security is threatened. Do we need any more evidence of that than the current economic environment provides? Vermont NEA supported and continues to support reforming our healthcare system so that it is responsive to the health needs of all our citizens, irrespective of their job. Thank you.